So quiet, guys. Good morning now. Here we are. It's my last lecture to you in front of you. It's crazy talk. But I'll have a recorded lecture up, and this lecture will finish the nervous system in terms of me giving it to you. And then next week, of course, you'll be here to be a test. So it'll be a test on chapter 10 and 11. Sample questions are open for you to use. Again, just these chapters, my lectures, and notes. Get ready for it. And then the week after is Thanksgiving, and then for the final week, I'll have recorded lectures on one chapter on senses. So taste and smell and vision and hearing. And then during finals week, during your test time, you will take an exam over just that one chapter. And all 4 exams are worth the most, so I hope you do well in the last one, just focusing on one chapter. In terms of lab, the next 2 weeks, you will do an in-person lab. We'll dissect an eye. We'll do a vision test. We'll do anatomy of the eye and the ear. We'll do a couple of reflexes that we can safely do. And then there'll be an online lab on reflexes and reaction times. Then, yeah, that's right, next 2 weeks. And then the week after Thanksgiving, you'll take a practical on those 3 labs. Meaning the 2 we do this week, and then the one on the central nervous system that you did already. That's it, man. And then your final paper, get into the paper. So 4 tests, 3 practicals, homeworks, quizzes. Yeah. All right, well, this lecture here will be, we'll particularly look at the peripheral nervous system now. So we've done the brain. We did the brains a lot, and how nerves function and action potentials and all that. And now once you leave the brain and spinal cord, you have the nerves that go onto my hands and my feet everywhere. And pretty much you have 12 pairs of cranial nerves off your brain. And every anatomy student in every country around the world learns the 12 cranial nerves. There's mnemonics to help memorize them. And there's tests to do to see if all these work. And then off the spinal cord is about 31 pairs of spinal nerves. That makes the nerves in my arms and my legs everywhere. Yeah, all the other nerves in your body. All right, and the rest of the peripheral nervous system, there aren't any cell bodies. When you look at a nerve, like you pinch a nerve, I can feel my funny bone nerve here. It's a whole bunch of axons, it's the wiring. The cell bodies will be back in the spinal cord and in the brain. And the only exception is there'll be some cell bodies out in these ganglia, these little swellings that hold cell bodies. Those are out there too. So we'll talk about nerves. We'll go through the cranial nerves. Yeah, and then my lecture that I leave for next time, I put a couple slides to introduce it, but I'll look at the autonomic nervous system. So you guys are always fight or flight or rest and digest. And you're kind of always on the seesaw. Somewhere in between sheer terror and complete crashing in front of the TV. All right, guys, take a look here. What do we got? Yes, so I just told you this, right? So 12 pairs of cranial nerves come off the brain, as I said, and they generally sort of just in your head. Oh, there's one that goes down to your traps and sternocleidomastoid, and then vagus, this wander goes all the way down to your heart, your lungs, and your intestines, your gallbladder, your liver, your spleen, your kidneys. So there's one nerve that goes all the way down the body, it's the vagus. But the rest of them stay in your head. They go to the facial muscles, and your ears, and your eyes, and your sense of smell. That's the deal with cranial nerves. Mostly staying up here in the head. And of course, the spinal nerves, you all know, come off between the vertebrae, intervertebral foramen, and they merge to form this brachial plexus that goes to your arms, and big sciatic nerve down your butt side. Now we'll get some definitions. Obviously, you guys know sensory and motor. Sensory is bringing info to the central nervous system, and motor is going out to make some kind of effect. And then the terms afferents and efferents also. Just keep that in mind. You ever see those terms ever? I look like a kindergartner when I write it, but did it go away for you too? Yeah. Afferent with an A is going to be sensory coming in. And when you see efferent with an E, has an effect. That's going to be motor. So afferent, you can think like alphabetically, A comes before E. So A is bringing information in, efferent. And then a couple other terms, once you know these, you're in good shape, is somatic and autonomic. So autonomic is like automatic. That are things that control your heart, your blood vessels, your guts. You know, you're not controlling your intestines right now. You're not controlling how tight your blood vessels are constricting. That's autonomic. So your brain is all this background stuff. And then somatic means soma means body. It's going to be, really we're talking about your muscles and your skin. Information coming back that you're made aware of. So somatic, you think about it, if people touch you, you're feeling things, and or you're making your muscles contract. That's somatic. Viscera is your guts. Viscera is your stomach, intestines, your heart, your lungs. Viscera means guts. It's like I had a visceral reaction to that car accident, a gut reaction. All right, so we'll get back to that in just a moment. But first of all, the nerves. So these peripheral nerves, when you dissect a person or an animal, you will get into the muscles and the fascia, which is the connective tissue and fat in there. And then you'll see these white stringy things. Now the arteries and veins are hollow, but you'll see these white things, and they don't break that easily either. You get your probe in there. You guys did a fetal pig or a cat or something. You put your probe in there, and the nerves are kind of stringy and they're branchy, kind of whitish color. And the nerves are pretty tough. Like I say, if you get in there with a probe, like the fat will break, other things will break, but the nerves are kind of like, they're strings, they have some toughness to them. And it's because they have layers of connective tissue around them. Just like the muscles had an endomysium, perimysium, epimysium, the nerves are going to have an epineurium, perineurium, endoneurium. So we have these three layers of connective tissue. Especially that outer layer is really tough, that gives the nerves some strength, so they don't break easily. They tend to hold together. You don't want those axons stretching, they're delicate, little axons, little Schwann cells around them. So this connective tissue keeps the nerves tough and stringy, so they don't break as you guys run around. And so this is a good picture of a nerve. And it's a bundles of wiring. Again, there's no nerve cell bodies. There's no body, just wiring. And most nerves are mixed. That's another thing. We're talking about motor, sensory, or mixed, which means mixed means they have motor and sensory. So this median nerve going down to my arm, through my carpal tunnel, is sending motor to the muscles of my hand, and sensory, all the information for my touch receptors and my temperature receptors in my finger. So this wiring, some are going up, some are going down. And your body figures it out. So close up, every one of these little circles you see in there is going to be one axon. And it's got a mothership, the home, the body is somewhere in your spinal cord or in your brain. And those are the little axons that are really long that are carrying those action potentials. Beautiful. And again, the endoneurium is a little bit of connective tissue around each axon, usually over the Schwann cell that's protecting it. And then these bundles of nerves, these bundles, they're like bundles of muscle fibers. So they're called fascicles. Fascicle. Yeah, fascicle is this little bundle of wires. Just like if you look at a complicated internet wiring in one of your dorms or the wiring, the cables are bundled together so you can figure out which goes to where. So these little fascicles are the way that it's organized. And the whole nerve has an epineurium around it. Each fascicle will have a perineurium, like perimeter, and an endoneurium will go just delicately around each individual axon. And they all interconnect. They've got collagen fibers, they're tough, and they're going to make the nerves, that wiring solid, so it doesn't, even when it stretches, it doesn't break. All right, what do you guys think? That's pretty much all I want to tell you. You can see there's blood vessels and nerves. Especially like the big sciatic nerve, I think you can see the vessels right on it because it takes tons of energy, right? Along these axons, there's sodium potassium pumps, right? They're making that voltage difference constantly, and so these things are hungry for sugar and for oxygen. So lots of blood vessels on there. Oh, look at this. This is an electron micrograph looking at this. Beautiful. You can see those bundles of vesicles. There's blood vessels and UV in there. Going throughout. You see perineurium around it. Epineurium is around the whole freaking nerve. All right, I think I've got it down, right? So if I asked you guys in the test, what is the layer that surrounds the vesicle nerve? It's a perineurium. I say, what's the coating around the whole nerve? Epineurium. Just be ready. Oh my God, look at that. Beautiful. Gosh, that's so cool. And it's so cool if you look at it also from just the histological standpoint. You look at this highest magnification, these dark circles in the middle will be the actual axon. And then this clear area around it, I can almost see like concentric circles. Those will be those layers of myelin, schwanzels that are insulating. And I know that's made out of mostly fat. So I know when they made this slide, they put a piece of nerve in wax and they sliced it thin, and they washed off the wax. And those organic solvents washed away the fat layer. So it kind of looks clear around that solid axon in the middle. So beautiful. It shows all the nerves kind of spaced out beautifully in these kind of clear areas. And that'll be where the insulation is on these wires. And right now in that nerve, if you could look at it, there's electrical signals going up and down there. Each one of these is going, some are going up, some are coming down. And it's sending signals like that this feels smooth, all that's going to my brain. And then when I walk, it's going down my spinal cord and out my nerves. It's amazing to think about. Yeah, and it is electricity, It's electricity. At the end, it'll be chemistry. When the synapse, when the neurotransmitter is released, and there's like receptors, that's chemistry. And here it's just electricity. Blips going up and down. All right, and here's again the basics. Some nerves, like our optic nerve, is completely sensory. There's no like motor going to my retina. What's retina? No, it's just light's coming in and it's going back into my brain. So some will be completely sensory, some will be completely motor. You'll see the last cranial nerve just goes to muscles of the tongue. And so there's no sensory for my taste, anything like that. All just motor. So some will be purely motor. Although why don't I just tell you now, even ones that are purely motor, it's always a little bit of sensory because in your muscles you have receptors that are telling your brain how stretched the muscle is or the tendons are. So even if you wake up in the middle of the night or in the morning, and you can kind of tell where the position of your limbs are because there's stretch receptors in all of your joints and your muscles. So if you sit there with your eyes closed, you can kind of figure out the position of your joints because there's always a little bit of feedback. We call it a motor nerve anyway. It's mostly motor, just a little bit of feedback. But most nerves are mixed. Yep. In fact, all the spinal nerves, except the first one, that C1 comes off like right under the skull. It's purely motor, but the rest of them are all mixed. All the nerves in your arms and your legs are mixed. It's sensory and motor. All right, that's pretty good. Now, in the next couple of slides, there'll be some classifications. We'll see some classifications. Besides merely mixed motor or sensory, I'll show you. So I'll just give it to you. So general is just normal. We're going to see special senses are like vision and smell. Those are special. But so general, somatic, efferents. I know it's a lot, but it means just normal. And somatic means it's going to go to your muscles. So some kind of motor. Efferent is motor. General somatic afferents will be sensory from your body, your skin, and your muscles going back. So those are normal. General, somatic means skin and muscles. And it's either afferent going in or efferent going out. On the other hand, when you add visceral, it's Instead of somatic, things it's your guts, things you don't control, your heart rates, your intestines going, things like that, your gallbladder. So if I hear general visceral efferent, that means it's going to go to my blood vessel, to my guts, to somewhere I don't control, my viscera. And afferent, general visceral afferent, means it's coming from my guts into my brain. That's my brain's way of going. If I got a tummy ache, if I went to that buffet and I had to just try everything, you know, that kind of stuff that's being reached in my brain. And some of it is conscious and some is not. And lastly, looking at the head, we have some special ones. So your special ones, these are all in your head. These are all cranial. We got, so special somatic efferent is motor. That's going to go to the muscles in your head. It's going to come from a cranial nerve off your brain. Muscles in your larynx for speaking, for your facial expression, little ones in your ear bones. Special visceral afferent is, in this case, visceral is only going to talk about here smell and taste. So when we talk about these smell and taste, olfaction and gustation, but smell and taste are going to be the special visceral. And then somatic is going to be special means it's going to be something with the vision or hearing, something kind of special. And it's going to be stuff going into your brain because it's afferent. All right, so some terms there. Take a look at them. Just make sure you know, basically just break it down. If it's special, something in the head, special senses like vision or something like that. If it's somatic, it means it's going to be skin or muscles. If it's autonomic or visceral, it's going to be something that is your guts. All right, enough with terminology. Woo! Here we go. Look at that. So cool. So cool. 12 pairs of cranial. You've got them, your dog has them, your cat has them. Yeah, let's not get into that. But these are branches that come off the brain itself. And there's 12 pairs, right? So there's actually 24. So right and left, you have these cranial nerves. And the first two kind of come off the cerebrum. And they're kind of weird. The olfactory and optic is for smell and vision. The rest of them go off the brain stem, come off the midbrain, pons, medulla. So the first two be kind of special. 1 and 2, which are big, you know, olfactory and optic for smell and sight. And they're numbered Roman numerals. And they're numbered, the first two, anterior to posterior, they're kind of down the brainstem. So they're just in order from the front to the back. So that's how they're ordered. It gets a little tricky way down here, but just go with it. Generally, number 1 is the most forward, number 12 is the farthest down. And they come off and they're going into the head region. Like I said, one of them goes all the way down to your guts, but the rest of them go to your face, your ears, your eyes, your nose. All right, so looking at these, and again, I've studied these for decades, you know, so I kind of got it. But for those of you, you need to start memorizing, flashcards. But olfactory, number 1, optic, number 2. Oculomotor goes to the eye muscles. This goes to one eye muscle. This big guy, trigeminal. See that? It has 3 parts to it. Trigeminal. Big one goes all your teeth. Facial is going to go to all your facial muscles for expression, right? Glossopharyngeal means tongue in the back of your throat. And then vestibulocochlear is going to your ear for hearing, of course. Hypoglossal means under your tongue. So lingual or glossal is tongue. A polyglot. That's going to go motor to your tongue. And then vagus means the wanderer. That's the one that goes all the way down to your heart, lungs, and guts. And accessory is going to go to, spinal accessory is going to go to your traps, sternocleidomastoid. Yeah, it's a weird one. All right, so let's just do it. First of all, I had to Google image search for Roman numerals 1 through 12. It's amazing. Some are very common and some are really hard to find. But someone has tattooed all of them, so for various reasons. And so I'm going to use these Roman numerals, and you need to just memorize them 1 through 12, right? 1, 2, 3, 4, 5, 6, 7, 8, and 9 is the 5x, right? 10, 12. All right, I told you guys. I think you probably know these. Oh, there's lots of mnemonics. I know a lot that I can't repeat to mixed company. They're often dirty kind of mnemonics, but you can use whatever you like. I thought Gross Anatomy, I had them come up with their own just to help them work with it. To touch and feel very green vegetables. Heaven, how that works. But the old days, it was on old Olympus towering top, a Finn German viewed some hops. That's what like your grandpa would. And one thing I should say too is that this A got turned into a V. So that vestibulocochlear that went to your ear used to be called the auditory nerve. That sounds easier, auditory for your ears, right? But it kind of neglected that it's not only hearing, it's balance. So your vestibule is where you get like your position, and cochlear means hearing. In case you're curious about the history, we used to call it the auditory nerve, number 8. Now it's vestibulocochlear. All right, so this is this caveat that I talked about. Even motor, purely motor nerves, they got some feedback from the muscle. And you need to know this word, proprioception. It means it's going to be your position. So there's going to be stretch receptors in all of your skeletal muscles. And in the tendons as well, to tell me how stretched my biceps tendon is, how stretched my biceps muscle is. And that feedback goes up. And so it's important, it goes back to your cerebellum for balance, you know, so your body knows where its parts are as it's going through the air. The proprioception is all your muscles and joints have sensory nerves on them. Cool, all right, we're just getting to it, man. I've been putting it off, but let's just get to the 12 cranial nerves. Number one and 2, olfactory and optic, to give you like the truth, they're really extensions of your brain. Early development, your eyes come as this extension of your brain, these little optic cups, they become the retina in the eye. Olfactory nerve is an extension coming off your cerebrum. It's got this olfactory tract and this bulb at the end where it gets kind of bulby. And then little tiny nervelets come off that olfactory bulb to the roof of your nose for smell. And now we're putting things together from the skeletal system, right? You guys remember here the ethmoid bone? That was that cribriform plate that had those little olfactory phragments, little holes. Those little tiny holes have little rootlets, these little bipolar neurons that have like little cilia. They don't move, they're just like little hairs that have receptors for various chemicals. If you smell ammonia, chocolate chip cookies, dead fish, all these smells have odorant molecules that are going to bind the receptors at the roof of your nasal cavity. And we'll talk about this in the next chapter. I love it. So yeah, so the roof of your nasal cavity is this patch of epithelium that's going to smell molecules, and the impulses will go up into the optic nerve and go straight back. And you should know the olfactory nerve goes right into your limbic system. Limbic system is your emotions. So you guys that are into brains know about the amygdala and hippocampus, things like that, important in memory. Yeah, so your sense of smell goes directly into your emotions and your memory. The other ones don't. So your sense of smell really elicits emotions. And you guys, before you're even consciously aware, a smell will have you feeling a certain way. You know? And retailers know this. Interesting, vanilla is like a really, everyone kind of likes that. There's a few people that don't like that. You hear about, aromatherapy, things like that. But if you smell like your childhood home or grandma's perfume or a lover's, smell or whatever, it has a deep emotional effect on you, and smell does. So it goes right to the limbic system. So, yeah, pretty cool. Purely sensory, right? There's no motor. I'm not saying olfactory epithelium do something. It's purely sensory. So number 1, olfactory nerve, sensory for smell. Number two is pretty hard to forget. Too, it's your optic freaking nerve that goes into your from your eyeball to your brain. So this is purely looking at the light that hits your retina. So I can my color vision, my dim vision. We'll talk about that. All this from my rosin cones goes through this huge nerve. You look at the size of it, man. It's a huge wire because it's got so many wires coming from all those rods and cones in my eye. So optic nerve, whew, it's a biggie. Now what I want you to know about the optic nerves is that they cross. So the optic chiasm. Yeah, and I want you to know where this information is going, because you need to know it for the brain anyway, is that it's the occipital lobe. So all this information about what comes in my eyeballs goes to the back of my brain, the very back of my head. And we'll talk about vision in the last chapter for the last test. But if you look at it, I want you to know the back of my brain, what happens is that the information coming in my eyeballs, it's actually split in half. Half goes to one side and half goes to the other. Isn't that weird? It's upside down too. So imagine if you cut this optic chiasm. You guys do this experiment in your head. Like, what would happen to your vision? You would be seeing the outside half of your eye. You wouldn't see the middle halves. It'd be weird. I'd just be seeing these parts out here. So it does this. It's going to go back. Vision's going to go back. The switching center, thalamus, and midbrain, and all the information is sent back to my occipital lobe. All right. Olfactory and optic are special. They're both completely sensory. And yeah. All right. So this last chapter, I'll talk about the muscles that move your eye. You don't have to know it right now, but you're going to know there's 6 muscles, extrinsic muscles that move your eyeball. Extrinsic means they're on the outside. They go from the eyeball to your skull. So they move my eyeballs around. When you're intrinsic muscle, that'd be the muscles in my eye that change my pupil size, that change my focusing, right? So extrinsic muscles are moving my eyeballs to look in different directions. Just like your tongue, you have intrinsic muscles so you can curl your tongue, move the tongue itself, and extrinsic muscles so you can stick out your tongue. They go from the outside to the tongue. Intrinsic is within the tongue. Same thing. So extrinsic eye muscles move your eyeball. And we talked about them real quickly when I talked about motor units, how these guys are really precise. They're small motor units. You guys are precise. Come on, look at a computer screen. Your eyes are darting between words. Wow. You're following a bird in the skies. And also, just to amaze you a little bit more, you've got 2 eyes. Like if you're watching a bird fly across the sky, opposite muscles in the 2 eyes have to work. Because my right eye is going to abduct, and my left eye is going to adduct. See what I mean? So your 2 eyes are coordinated and kind of back, like when you're watching things go like an airplane in the sky. The four muscles go straight back. They're called rectus muscles. They're straight. Remember rectus abdominis, rectus femoris. There's 4 rectus muscles, and medial, lateral, superior, they go back. And 2 oblique muscles, they go at an angle. The inferior oblique comes on the bottom. Superior oblique is weird. I got to show it to you. It goes across through this little pulley, and then it goes back. Isn't that weird? It's a little pulley that changes direction. So those are the 6 eye muscles that are going to move the eye. And so I need to tell you because we're going to see that 3 cranial nerves go to those. And on here, of course, you see the huge optic nerve, which carries all these sensory information. So number 3 is oculomotor. The name means, eye muscle, eye motor at least. So the oculomotor nerve goes into the orbits, and it goes to 4 of the 6 eye muscles. So 4 of the 6 eye muscles to move your eyeballs. You also need to know what's in the eye for focusing and changing your pupil shape. Focusing is called accommodation, and then it will dilate or constrict your pupils. You go into a dark or light room. Yeah, so oculomotor is important for most of the eye muscles and then also inside the eye. And so again, it's motor. This is moving muscles inside extrinsic and intrinsic eye muscles. Yeah, So there's a muscle that raises your eyelid. So how would you test if this is working? Oh, see if the pupils are responsive, right? This is going to be, shine a light and see if the pupils are responsive. They should constrict in the bright light. 4 minutes. All right, number 4. Trochlear nerve. Oh my God, this is so small. It goes to one eye muscle. One. It's going to go to that superior oblique. And trochlear means pulley. And that's because superior oblique goes to a little pulley that the muscle changes direction. It turns kind of tendinous, and then it goes from going medially toward your eye, then it goes straight back. I think that's all I have to say about this. Trochlear nerve goes to one eye muscle. Ooh, I'll show you. I'll just tell you first. A person can come into the doctor's office and their head is tilted to the side, and they think it's kind of normal. But obviously, everyone's like, "Dude, why put your head up? What? Their head's tilted." I'm gonna think there's neck muscles are constricted. There's a thing called torticollis. The neck muscles can be constricted. Turns out it has nothing to do with the muscles of the neck. It has to do with this particular nerve going to this muscle, because the superior oblique is going to kind of move the eye downward, rotate it. And so the person with this kind of issue, the eye moves and they just move their head to compensate. They think it's fine. So it's kind of a cool thing that if your trochlear nerve is screwed up on one side, it's going to make your head tilt in order to get a normal. All right, I tell you, this one will take a break because this is a doozy. This is the biggest. Biggest. Trigeminal, number 5. So it is a big one. And I talk comparative anatomy. We look at evolutionarily, and we'll see your tongue and the structures. Like all these structures in here come from pharyngeal arches of a fish. Right? And we'll see trigeminal and then facial nerve. Later on, we're going to go to 2 different pharyngeal arches that all of our muscles came from. That's why the traps used to be a muscle up in the head of a shark, and it migrated down. So the story is complicated. But for you guys, what you're interested in probably is, what are these nerves? What do they do? What happens if they're screwed up? So trigeminal, big one, has 3 branches. Trigeminal. And the branches are ophthalmic is going to go to your forehead and your eyes, obviously, in your eyes. Then you have maxillary and mandibular. So maxillary goes to your maxillary, your upper teeth, and then mandibular goes to your lower teeth. As long as the skin on your jaw, your lips, your gums. And trigeminal kind of goes to your tongue and inside your, like for touching your nasal cavity, and it goes to your scalp in front, behind your ears. So it's going to your facial region and inside your teeth. Very important. It's going to be mixed. It's going to be close. Oh yeah, so this kind of shows this distribution, doesn't it? It's like a mask. I could be trigeminal nerve power. And for those of you people interested in teeth, you can see this is the nerve we care about, trigeminal. And some migraines and such, you can have trigeminal pain. Here we go. You have the lower branch that goes to your lower teeth. It goes in this mandibular frame and it goes through the mandible. That's why the dentist can deaden all of your lower teeth at once by shoving that needle back on either side of your jaw. The little branches come up into the teeth. The maxillary branch, they come down. You can't really see that. You got to kind of individually anesthetize the teeth. So here it is. Number 5 is definitely has some motor and has a lot of sensory function. Let's take a look. Oh, yeah, that lingual nerve that goes to your tongue is going to be for touch on your tongue. Well, touch and pain, that kind of thing. It's not for taste. And then you see that branch goes to your lower teeth. Beautiful, right? All those are that mandibular branch. I see that the maxillary branch is going to go to the upper teeth. It's going to come out, goes up on your skin here. That does the inside of the nasal cavity. And the ophthalmic division goes up into the eye socket. And it's going to come out on your forehead, too. Little holes up here, comes out on your forehead. All right, so ophthalmic, right there. Surface tear gland, scalp, forehead, upper eyelids. Maxillary, your upper teeth, your palate, the roof of your mouth, and it comes down your face, below your upper lip. And mandibular, your lower gums, your lower teeth, your lower lips. And it goes to just a couple muscles that are in your mouth. And you don't have to know them. We didn't learn them, small muscles. So trigeminal gets the mixed designation because it goes to a few muscles. All right. 8:37. So approximately 37 minutes. You guys definitely need a break. So 8:41, I will continue on and do the next one. Any questions?
Well, we get rest. We get no resting in this class. We need to continue on. We got some more nerves. Where are we at? We're at 6. Oh, we're halfway. That was perfect stopping point. Halfway. Number 6 nerve is called abducens, and it's going to abduct your eyes to make you look off to the side. There you go. So it goes to one eye muscle. You make a lateral rectus, and the outside is going to move your eyes to the outside. Yeah, that's it. It's really small. That's all it does is motor to one muscle. So without it, if it happens to be paralyzed, your eye is going to drift inward. You'll be cross-eyed. And so this person can move their eyes to the right, or they can't move it to the left. You can test that, have something to the outside, and pull the eyeball out. That's all I got to say about it. All right, number 7 is important. So number 5 is the trigeminal. Number 7 is the facial nerve. And this goes to, for the most obvious, is all the muscles of expression on your face. So what I'm showing here is that trigeminal also goes to a lot of your face. And it's going to be sensory, a lot of sensory. It's going to go to the inside of your tongue, your teeth. The facial nerve is going to go to all these muscles on the outside of your face. It is also mixed. So obviously it goes to motor, and it has some sensory too. In fact, it's going to go to, we'll see, it's going to go to the taste in the anterior 2/3 of your tongue. Your tongue is freaking complicated. Your tongue came from 2 of those pharyngeal arches, so it has the trigeminal nerve goes to it. We talked about that trigeminal nerve for touch on your tongue. For taste, it has the facial nerve in the front of the tongue. As the Glossopharyngeal in the back of the tongue, a little bit of vagus goes to the tongue. And then motor is going to be number 12, hypoglossal. So I know I just went over your head, but you can see all the cranial nerves go to your tongue. You have motor, of course, moving your tongue. Essentially, you have taste. So facial does most of it on your tongue. And then you have just touch or pain. Woo. So your facial nerve, number 7. So it's going to go taste in your tongue, and then motor to go to you guys to make facial expressions, of course. Yep, and it goes to some tear glands and salivary glands too. You don't have to know this, but you guys know these words, so it's pretty cool. You know it has branches that we call in the business. The temporal in your temples, zygomatic or zygomatic bone, buccal, like buccinator, your cheek, mandibular along your lower jaw, and cervical on your neck. So you guys know these terms, so I thought I'd throw it out there. Gross anatomy and such, when you get more detailed facial nerve, you learn these major branches here. You see it goes to this big spit gland right here. You have these big parotid glands. It goes through there and goes onto your face. And here's the first pathology, is Bell's palsy. And this happens again to any age, but all of a sudden half of your face goes kind of limp.
and you'll be drooling out on one side. You can't really close one eye. It's kind of expressionless. So the facial nerve on that side has become inflamed, or a virus has infected it, and for some reason, this facial nerve, when it's inflamed, it can't work those muscles on one side, so that one side of your face is kind of droopy. Almost always it goes back to normal after a period of time. In rare cases it doesn't. Those problems, half the face would be droopy. The facial nerve on that side. Number eight, guys, for hearing and balance. So it used to be called auditory, but we're not going to say that. It's vestibulocochlear. Got more difficult, didn't it? But your vestibule is for your balance, for what position your head is in your body. And then cochlear is where you have your hearing, and your cochlea is that snail shell where your hair cells are for hearing. So vestibulocochlear, number 8. It goes from your inner ear, your temporal dome, it goes into your brain, and it sends all the signals from your balance and hearing. So it's going to be sensory. Right? Yeah, that's all I got to say right there. One cause of deafness, if you have a problem with the vestibulocochlear nerve, maybe your hearing is fine, but the wiring doesn't get it back into your brain. All right. Hearing will go to your temporal lobes eventually. All right, big picture again. Work our way down. You see olfactory, optic, oculomotor, trochlear, trigeminal, abducens. Look how small the abducens is. See, just a one eye muscle. Trochlear, just a one eye muscle. So the size of the nerve tells you like how much work it's doing, really. The trigeminal, facial are big. Optic and olfactory are big. But abducens, trochlear, oculomotor, they got us a little eye muscles, so they're small. Beautiful. So what do we have left? We did facial nerve too. Your facial muscles, and then vestibulocochlear going to your ear. So we're down to these ones at the bottom half here. Number 9. Number 9 is glossopharyngeal. The tongue and pharynx. And it is mixed. It's going to go like kind of the gag reflex, your little uvula back there, the back of your throat. It goes for taste at the back of your tongue. So that's all sensory. Also sensory, it goes down, we're going to talk about next semester. You have a carotid body, carotid sinus, and your carotid arteries that sends signal about your blood pressure and how much carbon dioxide levels and your oxygen levels. So it's a branch that goes down to this where the carotid artery splits, and it gives information about your blood pressure constantly to your brain. So we'll mention glossopharyngeal next semester when we do blood pressure. And then it goes to motor to a couple muscles in the back of the throat for swallowing. So glossopharyngeal is mixed. You should know sensory, kind of your pharynx, back of your throat, and taste in your tongue. Motor to some throat muscles. That's all you need. Number 10 is important. We will talk about that next semester all the time. We talk about the heart next semester, your heart rate. I will tell you the vagus nerve innervates the pacemaker of the heart. And it's going to slow down the heart. When we do the intestines and stomach, I'm going to tell you, you could cut branches of the vagus nerve if you have like terrible, too much acid in your stomach. What are holes in your stomach? You know? Ulcers, like if you have had too much acid production. So your vagus means the wanderer, and in fact, it goes the farthest distance. It comes out of your brain, goes all the way down to your large intestine. So it goes to your heart. It's called parasympathetic. Now, if they're parasympathetic, that's my next lecture, my recorded lecture. That's your rest and digest. Sympathetic is fight or flight. So parasympathetic is rest and digest. So as long as you know that, you know it's going to slow down the heart. And it's going to increase your guts. It's going to make your stomach and intestines, the juices are going to be flowing, that kind of thing. Yeah, and in the lungs, it will kind of constrict the bronchi, you know. Like if you want to fight or flight, you want your bronchi to be big breaths so you can run, right? So parasympathetic just like, oh, no big deal. I don't need to use my lungs that much. Heart, relax. So that's it. It's a huge autonomic nerve. It's most of the parasympathetic system in our body, how we rest and digest. But it does some other things too. Oh my God, yeah, it goes to your back of your tongue. Yeah, some muscles. So it's definitely mixed. So most of it is sensory, motor too, and it's all autonomic, right? Yeah, it's autonomic. Cool. All right, I'll show you just for fun. When we dissect body, you can find the vagus nerve running along the carotid artery and jugular vein going down to your guts, right? And there's a branch that comes back up called this recurrent laryngeal, comes back for speech. Sometimes you have a tumor down here, it pinches on that, and your voice changes. But it's weird. It's just evolution. The vagus nerve came down, this recurrent laryngeal went back up, like recurrent against the current. And what's interesting when you look at a giraffe, the vagus nerve goes all the way down, and then it goes back up like 15 feet. It makes no sense if you just like go over. But it shows you in evolution, it's just the neck got longer, the nerve just got longer with it. Almost done, people. Number 11 is a small, not very important one. Well, I take that back. Accessory nerve, or spinal accessory nerve. And most one for you guys, you should know, it goes to your traps and sternocleidomastoid. And it goes to a couple of muscles up in your throat too. So yeah. Let's just know that. Spinal accessory, number 11 goes to your traps. So if there's an issue there, you can't really do shrugs. If you're very weak with shrugs, it could be an accessory nerve. And they test all these spinal nerves, these cranial nerves. They can test them with different tests. Like do your pupils dilate, can you do shrug? So they can do these quickly to assess them. All these cranial nerves, they go through little holes in the skull. And sometimes those holes can be the bony growth can compress them. That can be one cause, or they can be infected, something like that. So they do reflexes test on all your cranial nerves. There's a whole like laundry list if you want to test your cranial. The last one, number 12. Finally, number 12. Hypoglossal means under tongue. And you need to know it is motor for the tongue muscles. Yep, motor for the tongue muscles. So it's how you move your tongue. Hypoglossal. Nothing to do with taste, nothing to do with touching your over texture on your tongue, nothing to eating spicy peppers. No, it's just going to be moving the tongue. The taste is facial or glossopharyngeal, and hypoglossal is purely motor to the tongue. Read that in the back. It's from the book. Anyway, so just I will ask you questions in the test of the major cranial nerves and their major functions. And of course, I'll only ask like 3 or 4, but you don't know which one, so just got to kind of get ready for that one. Any questions on your cranial nerves? I've given you the overview of that. All right, guys. There you go. Depends the level you want to know. If you really want to get into them, you can learn a lot more. I give you the big picture. All right, so the rest of the time, we'll talk about a few other things. All right, if you want to have a baby, or if you don't want to have a baby, you have a baby. So all of a sudden, you think to yourself, how do I want to do this? Because you have choices. In the old days, you just squatted in the field, the baby came out, whatever. Now you have choices about anesthesia, how much you want to feel. So giving birth, you can be completely unconscious. You can be in a coma and give birth, right? Don't feel a damn thing, right? But often people want to be there for the beauty of childbirth. It sounds painful and messy, but you know, apparently some beauty there. The beginning of life, I guess that's kind of it. So you can get a spinal block. You can say, all right, I'm getting in labor, I want a spinal block. And they can put anesthesia in your cerebrospinal fluid down the lumbar region. You don't feel anything from there down. Yeah, that's cool, spinal block. But the most common is an epidural. And I already told you guys about this. Put the anesthesia not in the cerebrospinal fluid. Don't give anesthesia in the bloodstream, like to put the mom out, but instead put it in the fat that surrounds the spinal cord in the lumbar region. It's in the fat, all the nerves leaving it are deadened, so you don't feel anything. So it's a great way to get rid of pain. So epidural, half of laboring women. Yep. By not putting it in the blood, there's also no chance it gets into the fetus too, because it's not the bloodstream. Cool. And the problem with the spinal block, and none of these work if you're like you're about ready to give birth, like it's too late, that ship has sailed, right? You got to know a little bit ahead of time, because there's no needle in your back as you're contracting, right? So you got to kind of plan on this, or else no, you're having the kid with no anesthesia. The problem with that spinal block is that you're putting a needle in through the subarachnoid space. You have a chance of damaging or causing a leak. And often women that have the spinal block, they can't sit up for, like I say, like 8 hours, something like that, because it causes a great headache. And so there's less complications to get an epidural. Put the anesthesia in that fat, and it does the same job, really, as putting it in the cerebrospinal fluid, where it's going to travel up to the brain after too, right? So it just gets degraded in the fat. You can feel things once again. Any questions? Or you can say none. Forget that. I don't need anything. I'm tough. I don't know. I'm not a woman. I've never had to make this choice. All right. So these spinal nerves, you got about 31 pairs. And they come out. You guys know they come out the spinal cord like every once in a while. And I drew the spinal cord up here for you guys. So you have dorsal roots and ventral roots. They come together to make a spinal nerve. And the spinal nerve has the dura mater still attached to it. It comes out between each vertebrae. And that's how we number them. C1, C2, C3. All these nerves come out right and left. And I'm showing you here what can happen is that little hole they come out, you can have these bony growths and they can become impeded and you start having pain. So when you narrow this, called stenosis, you narrow that hole, you could be pressing on that spinal nerve, causing pain and paralysis. And of course, you slip a disc or something like that, also cause less space, the nerve gets impinged and you have pain. Now, once again, don't forget, you have 8 cervical nerves. I know, we have 7 cervical vertebrae, but we name them below the vertebrae. And number 1 comes up between the skull and the pelvis. C1 through C8, T1 through T12, L1 through L5. You have 5 sacral and 1 coccygeal. Pairs. All right. So 62 total spinal nerves. And again, make sure you guys know that these your spinal cord ends around L1, L2. Remember, if your body grows faster than the spinal cord, you end up with it not going all the way to the bottom, but it ends up at L1, L2. So those lower spinal nerves really go straight down and out. The ones up high just go straight across. The ones up high like this, but as you go down, they start getting more and more of an angle until all the spinal nerves that come off these lower ones turn to this cauda equina, like horse's tail that comes down. And so taking a look, just to review, dorsal is going to be all sensory. Ventral is going to be all motor. And so you see it leaving the spinal cord, the spinal nerve on each side, right and left. You see it's going to branch. Talk about a couple of these branches. It's going to branch to your back. The main branch is going to go to your belly. Beautiful. So look at this. You guys should feel comfortable with this. You should know that that dorsal root is getting all the sensory. And you should know what it means that it's going to be somatic or visceral. Somatic is your skin and muscles. Visceral is your gut. So you can see here's the cell bodies and that ganglia. And it's going up north, dorsal. You can see all the motor. The cell bodies are in this ventral horn, and they go out the ventral side. And the spinal nerve itself is mixed. The spinal nerve has both motor and sensory. And so it's mixed, but you can see they completely separate into the dorsal and ventral halves. Any questions? And then gray matter, the butterfly, is all the cell bodies. And the white matter out here is all the wiring. This would be a cool Halloween costume as well. The spinal nerves, we can map out where they go generally, and a dermatome is mapping out where each spinal nerve goes to what part of your skin. You can do it for muscles too. It's called a myotome too. And so this is good for testing if you have a spinal nerve problem. Let's say you got a disc or a spinal problem. Just take a pin and go down the side. You feel this, you feel this. Oh, you don't feel anything. And if you feel this, you can tell what level it is. There's overlap. So it's probably there's overlap, but they'll give you an idea of the right and left side. You have a spinal nerve that is hinged. Cool. Notice the front of the face, nothing. That would be that trigeminal. Oh, and you can see dermatomes, you can see them expressed in people that get shingles. Now, shingles is a viral disease that is the same as chickenpox. You guys know this, right? Chickenpox, I had as a kid. You guys know it. You don't get chickenpox these days, right? The vaccine, but I got chickenpox, and I got chickenpox. It really sucks. And then in my nerves, sitting there, is the virus the rest of my life. All right? And it's quiet, and I don't even notice it. But when you get older, for some reason, that virus can wake up in my nerves, it can travel the nerves and cause really painful actions called shingles. They just came up with a vaccine, Shingrix. I happen to get it. You get it when you're 50, that's when you can get it. And it's kind of low supply, but anyway, it's going to help prevent shingles. But it shows you because it comes from a certain dermatome, because it travels in the nerve, because it was back there in the spinal cord, waiting in that ganglia, and then for some reason it wakes up. It goes down the nerve and it causes havoc along the dermatome. All right, let's get in there. It's so cool. Look at the spinal cord. And again, it sits in a water bed. It's a wash, and that subarachnoid space has that cerebrospinal fluid. So when you guys jostle, it doesn't get slammed against the wall because it's in this water bed. And then the epidural space out there is fat. There's cushion up there too. The spinal cord is headed in the middle of this water bed. It's got fat around it, so it's pretty well protected, unless you guys do some serious damage, right? And then between each vertebrae, you can see where a spinal nerve is going to lead. So at each level, between the vertebrae, a spinal nerve leads to the right and left side. Yeah, it actually carries a bit of the dura mater with it, so it's in this tough little sheath. And you'll always see a swelling. That's the dorsal root ganglia. It's for the sensory neuron cell bodies. And then when the spinal nerve leaves, it's mixed at this point. There's going to be a little dorsal branch and a big ventral anterior branch. So a little one that goes posterior to the back and a big one that goes to the front. I'll show you why. Oh, you guys, it's just review, right? With dorsal sensory, ventral motor. Oh, here we're going out more. So the spinal nerve is the dorsal and the ventral. Ramus is a branch. Ramus of your jaw is this part that comes up. All right, so what you have here is going to be, we're going to see the dorsal branch is going to be little. It's going to go just to some skin and some muscles along your back. The ventral or anterior part is going to be big. So that's going to go to your whole front and your arms and legs. So the dorsal branch is small. The ventral branch or anterior branch. We have a meningeal branch. See that I drew it in red? It kind of comes back and it innervates the meninges. Some blood vessels around the spinal cord. And then in the middle region, like here in your thorax, in the middle of your chest, there's going to be this, it's going to be a long chain that's going to come down, called the sympathetic trunk, sympathetic chain. These are ganglia. These are ganglia. They're going to run on either side of your vertebral column. And in the middle, we're going to have little branches that come out to you. So I'll show you that next. Here it is here. Actually, yeah, this is going to be a branch of the biggest. This is going to be the sympathetic trunk. This is trunk of the ganglia. All right. I'll get back to that a little bit. So this is our body. This is your body. Notice that dorsal branch? It's just doing like these back muscles in the skin in your back. Look at the ventral branch. It's going nuts. It's going to be all of the front of your body, the sides of your body, and all your arms and legs, which are the big nerves. So what's going on? Well, early on, we were more like a fish. And we had about equal. We call it the epiaxial and hypoaxial muscles. If you look at a piece of tuna like this, something like that, you know that if you cut it like that, there's going to be a line. There's the upper muscle and the lower muscle. There's a little bit of connective tissue there. And so these muscles here used to be equally get 2 branches in the spinal cord, dorsal and ventral. But in us, this dorsal part got really small, and the ventral part became a limbs much bigger. Just let you know that dorsal and ventral branches, what's the deal there? All right, so these spinal nerves come out, and they're going to make, especially the nerves in your arms and legs. And if you think about your body, that's where most of the sensation is, your limbs, right? All your arms are like motor nerves too. So you already know the spinal cord is particularly swollen up in the cervical region, down here in the lumbar region because of that. Now, nerve plexus is where the nerves come out, they connect, they separate, they reconnect. So plexus is a complex little weaving of the nerves. Indeed, we have a cervical one, stays up in the neck. Brachial plexus is most famous, it goes into your arm. And then a lumbosacral plexus, it's going to go to your leg down below. So cervical plexus, way up high, see 3, 4, 5, way up high. It's going to go to some structures in the neck. The only thing I want you to know is there's one nerve that goes all the way down called the phrenic nerve. Phrenic with a PH. The phrenic nerve goes to your diaphragm for breathing. So you say to yourself, probably, why is it coming off the neck? Should it be coming off down in the thoracic region? Well, the diaphragm is a muscle that mammals have. It used to be up higher in the neck, and it migrated down to below your chest, and it took the nerve with it. So, evolution can explain everything. So this is the phrenic nerve. Yeah, cool. So this is a human body. You can see close by, this is the vagus nerve. Right here, the vagus nerve, the big one. The phrenic nerve comes out, and it goes to your diaphragm on either side. So if you cut one phrenic nerve and not the other, you're like half breathing. If you cut both of them, you don't breathe. So the phrenic nerve comes off your neck, goes all the way down to your diaphragm. The brachial plexus is so famous. Any of you that take gross anatomy, you're going to hate this. There's so many complicated stuff going on. But it goes to your armpits. And people will pinch some if they like paint ceilings too much. So it goes to your arm. You don't want to wear crutches and just lean on the crutches because it's going to press on the nerves. So brachial plexus is going to come off the end of your neck and then a little bit of your cervical, a little bit of your thoracic. C5 through T1. That's the first thoracic and then the last cervical ones. And it just goes nuts. It makes these nerves that go to your arm. You're probably wondering, how much nerves do I have to know in this class? I'm going to tell you 3 nerves in the arm and 3 nerves in the leg. So in the arm, there's the 3 nerves. I'll show you a picture, but the median nerve runs right down the middle, and it's going to go through the carpal tunnel to your hand. So it's going to do all these flexors, and then to your hand. The ulnar nerve is on your pinky side, and I can feel it here in this little groove right here. This is where people hit their funny bone. The ulnar nerve is right there. Some pictures, it actually comes out. So that's the ulnar nerve. It goes to your pinky. And then the radial nerve is going to be your triceps, your whole extensors in the back, and it goes to the back. I'll show you a picture. Oh my God, yes. So this is the brachial plexus. Look at that. Roots, trunks, divisions. We don't need to get into this. All right, we don't need to get into this. We need to know the 3 nerves in your arm. But damn, look at that. They like separate, reconnect. They don't know what they're doing. Oh, gorgeous. So basically the arms, the nerves of the arm, if I say what goes to the back of your hands or the back of your forearm, it's the radial nerve. So radial goes to the whole back of your arm and forearm. The median nerve is the big one that goes right down in your flexor muscles of your forearm, and it goes through the carpal tunnel into your hand. The ulnar does your pinky and half of your ring finger, in case you guys really care. So pinky side, ulnar, your ulnar is your pinky side. So the ulnar nerve goes there. And it makes up your funny bone that you often hit because it's right there. All right, big nerve to the arm. I'll give you the 3 major ones. What about the muscle, the nerves to your leg? Well, the most famous is the one that comes out of your butt back here, the sciatic nerve. Sciatic is the biggest nerve. So we'll talk about that. Sciatic nerve does the whole, comes out of your gluteal region, it does your hamstrings, everything from your knee down. So the sciatic nerve is a big one like that. The front of your leg that does your quads would be the femoral nerve. That's easy to remember. Femoral nerve does the skin and the muscles in the front of your leg. And then your adductors in the inside of your thigh, it's called the obturator nerve. You can see it comes off the whole lumbar and sacral region. And they just, this plexus is complicated, but they all eventually make these big nerves. And these nerves also go into your pelvis and things like that. So here's the big old sciatic. People get sciatica, very common. And some athletes and such, you could have the piriformis. There's a muscle we didn't learn, small muscle in there that can push on the sciatic nerve. Everyone's different. Sometimes the sciatic nerve goes right through the muscle, sometimes above, sometimes below. So a lot of variation there, but it runs down the whole back of your thigh. And at your knee, it's going to split to go to the front and back of your leg and your foot. So sciatic nerve is everything below your knee, and then your hamstrings in the back. So it's a big nerve. Yeah, many reasons you can get sciatica. It's pinched at some point. For me, it was pinched in the, as a disc, a bone in the disc. Here, it's because this muscle is too tight in the knee or other reasons. All right, sciatic nerve, biggest nerve. Comes out of your whole back here, your pelvis, and all the way down to your foot. In the front, you guys remember the pelvis bone is called the obturator frame in that hole? Well, the obturator nerve goes through it. There's a little hole in it. The obturator nerve goes to the adductors in the inside of your leg. And the femoral nerve comes out here to go to your quads, the front, femoral nerve. Bam, I told you, 3 nerves in the arm, 3 big nerves in the leg. Questions there? All right, so what happens between the brachial and lumbosacral plexus and your chest region? Not much, not very interesting. You just have the muscles between your ribs are called intercostals. So everything from T2 down to T12 are going to be intercostal nerves between each rib. They're going to go to the skin and your intercostal muscles for breathing. How's that? Remember, these are all going to be the anterior branch or ventral branch. The dorsal branch goes to the skin muscle of the back. All right, and so my recorded lecture, I threw a couple slides from the beginning, just because I had you in person. You guys, your brain, your whole body goes through a period of either, like I say, like fight or flight or rest. Like if a fire alarm goes off in the middle of the night, you go from this to this, right? And then if you want to, like, you have Thanksgiving dinner, you go from this, well, you have to meet the relatives, maybe in-laws, and then you go into this. So you have this fight or flight is a lot of adrenaline, and your pupils are big, you're breathing, your heart rate is fast. Yeah. Parasympathetic over here is going to be your heart rate is slow, your digestion is going. Yeah. It's why after a big meal, you don't want to swim. Mom always said you can die if you swim after you eat, etc. You can't get cramps. Your blood can only go so far. So we'll talk about this in my last lecture. You can see somatic is your body. You're choosing to move your muscles and you feel your skin, right? Autonomic is behind the scenes, it's automatic. And so we'll talk about sympathetic and parasympathetic. So you all know adrenaline is sympathetic. Epinephrine, adrenaline. Parasympathetic will be acetylcholine. It'll be relaxing of the muscles in your breathing and heart and encouragement of your gallbladder and your intestines. Indeed, and so a lot of your organs have nerves from both. So my heart has the vagus nerve, parasympathetic slowing it down, then has sympathetic branches speeding it up. My pupils, they've got a nerve, oculomotor is going to go to it, and it's going to cause it to constrict my pupil, or if I have a lot of adrenaline, you can expand my pupils. So fight or flight, your pupils get big, you're ready to see everything. If there's like an enemy, you need to run away. So we'll see that. But if you live your whole life fight or flight, you guys would just have high blood pressure and do that, right? And so some people, take drugs to help lower their heart and things like that. So parasympathetic allows us to survive at a lower level. Yeah. All right. I wanted to say Nancy. I don't know why. So I kind of introduce it, and then the rest of my lecture will be kind of a short one, but I will record it for you. All right. I'll see you guys in lab.